According to the American Association of Clinical Endocrinologists, as many as 13 million Americans may suffer from undiagnosed thyroid conditions. If you're feeling sluggish, bloated, or always cold, is this something you need to look into? Joining us to talk us through some of the symptoms and treatments for thyroid disorder is endocrinologist and thyroid specialist, Dr. Kent Holtorf. Dr. Holtorf, thank you so much for being here. Welcome.
Hello, how are you?
I'm fine, thanks. So the numbers of potential thyroid problems are actually quite high. Let's just start with the basics. What is the thyroid and how common are problems with it?
Well, the thyroid is basically a gland right in your neck where basically it controls all the cellular function of the body. Really, it's kind of the gas pedal for the metabolism. So when you have low thyroid, think of kind of low metabolism. The body just functions very slowly. So we see fatigue, depression, weight gain, all those things associated with very sluggish metabolism.
All right, we have up some of the symptoms right now. And in addition to those two you just mentioned, there's also depressed moods, brain fog, hair loss. Some of those might seem rather common. What is it about them, or what kind of red flags should we look for if we're feeling some of these symptoms?
Well, you look for a number of symptoms, and that's a problem with thyroid. Every cell gets different amount of thyroid, which is why you see a wide range of symptoms. Some people may just have fatigue, other ones weight gain, other ones depression, other ones may have hair loss, cold hands, cold feet. So a doctor really needs to be aware that it could be thyroid. And the biggest problem is in the diagnosis, in that the standard test, which 90+% of doctors use, is missing a large majority of these people that could benefit from thyroid.
So what is it? Are these extreme conditions then? That's when you should go in and ask for the tests? Because a lot of these people might just think, look, I'm tired, I'm overworked, I'm not getting enough sleep.
Right. Many doctors will say, well, they'll do a simple test called a TSH, and if that's normal, they'll say, well, you're just getting older, you're just depressed, here's an antidepressant. When actually bringing their levels of thyroid to much more optimal, all those symptoms go away. So really the symptoms were due to low thyroid and not for other reasons. So, for instance, the STAR report, largest study done on antidepressants, showed that giving thyroid, even with so-called normal levels, was a better antidepressant than antidepressants. So what we're finding is the test we thought was so simple and accurate is not.
So what is the answer?
Really, doctors need to look deeper. You can do a much better test than just the TSH test. You look at what's called a free T3 reverse T3 ratio. You look at things called sex hormone binding globulin, and really look at the symptoms. And oftentimes giving a little bit of thyroid and bring the levels to more optimal, all the symptoms will go away. But again, doctors are just kind of refusing to do anything further than what they were taught in medical school and been doing for 20, 30 years.
So when we talk about the treatments, do people tend to feel better right away? Does it take a long time?
That's a very good question. The problem is that just like the testing, what's been given over the years has been called Synthroid or T4, which is inactive thyroid. And the hopes were, and the thought was, that the body would just naturally convert it to the active version. But what we're finding, that's not the case, especially for conditions such as depression. You don't convert. So basically you have enough of this inactive around, but you don't have any active. Chronic fatigue syndrome, fibromyalgia, even just dieting, the body will not convert that T4 to the active T3. So although those levels look normal, the people are actually hypothyroid inside the cell.
And what is hyperthyroidism, actually?
Basically, it's the exact opposite of hypo. So instead of having not enough thyroid activity, you have too much. This is usually caused from an autoimmune disease where the antibodies will attach to the thyroid receptor and cause it to overstimulate.
Okay, and why do we see more cases in women versus men?
It's interesting, a couple of reasons. Well, when you look at autoimmune thyroiditis, which is called Hashimoto's, women are more likely to have autoimmune disease, so they get that more often. But more importantly, women actually have less thyroid receptors than men. So small changes in thyroid level will actually cause a much more profound difference in women than in men. Men can tolerate drops in their thyroid level, where women will feel terrible oftentimes.
And are there any ways to prevent it or at least minimize your risk?
Well, really, it's interesting because a lot of things can cause low thyroid, again, but the standard test may look normal. Stress, dieting, drinking out of plastic water bottles now is shown to reduce thyroid levels. The bisphenol A, that BPA, will actually block the thyroid receptor. pesticides, plastics. There's so many things we're just being bombarded, that are lowering our thyroid levels. But again, when we look at that simple test that's showing to be inaccurate, people look fine, so they go years and years feeling terrible, just being told they need to exercise more, or they're just depressed, or they're just getting older, when all it would take is a little bit of thyroid replacement.
And I think it's probably worth reiterating, you had mentioned this earlier, but find a doctor that doesn't just rely on the TSH.
On the TSH, right? If the doctor just says, let's do the TSH and everything's fine, keep looking for another doctor, because seemingly very respectable doctors are refusing to change what they've been doing because they said, well, it's simple, my patients are fine. But again, if you don't ask and don't do more investigation, yeah, they seem fine. But when you do more thorough testing, such as the free T3 reverse T3 ratio, and really listen to the patient, they'll find so many patients just have profound results by replacing thyroid.
All right, Dr. Holtorf, thank you so much. Really interesting stuff.